Family building is supposed to be easy, and it can be a shock when it's not. The roller coaster ride of infertility can be a mix of emotions and conflicting advice along the way. As a reproductive endocrinologist and former fertility patient, I not only help patients build families every day, but I remember what the ride was like for me. Hang on tight as we learn together from experts and share stories from infertility warriors with compassion. I'm your host, Dr. Lora Shahine, and this is Baby or Bust. Welcome to the Baby or Bust podcast. I'm your host, Dr. Lora Shahine, and today we are discussing an incredibly controversial but important topic, COVID and fertility. This is going to be a little bit of a different format from the rest of our season. You're used to me interviewing a guest, and today it's just me. And I'm going into a deep dive into this extremely important topic. I want to navigate through the rumors, the misinformation, and the evidence surrounding COVID and fertility. It has taken me a while to wrap my head around doing a whole episode on this extremely controversial topic. I am living and breathing life as a fertility doctor and helping my patients navigate through all this confusion surrounding COVID and the vaccine, but it is an incredibly politicized, hot, and controversial topic. And so I wanted to do it right. So the topics that I'm covering here, the information that I have here is all answering questions that have come from you, questions that have come from my patients, questions that have come from me. In the beginning, we didn't know how getting a COVID infection impacted fertility or sperm counts or pregnancy. We didn't know what the vaccine would do and if it would be protective or not. But now we have data. This is a big, huge topic. Quite honestly, I've been nervous about this. I'm excited because I've worked so hard on all this information, but I've been really nervous because I know anytime a healthcare provider or a doctor goes out and talks about COVID, I'm just ready to get, annihilated on social media. But it is so important, and I want you to have the information because the questions keep coming and we do have answers, and I really, really, really want to help. It's not surprising if you're confused about the topics surrounding COVID and the vaccine and fertility. This has been one of the most controversial topics throughout the pandemic. But one of the main reasons that people are still citing not getting the vaccine is because they are afraid that it might impact their current or future fertility. It is okay to be cautious. I'm not surprised if you're confused. The science has been politicized. There's so many confusing recommendations. Fertility patients are particularly vulnerable. They will do anything to have their family. And I have been there. I have struggled to build my own family. And deep in the thick of it, I would have done any diet, any exercise, limited anything like caffeine, taken supplements. I understand the desire to do everything right in air quotes, because when you are trying to conceive, especially if it's been tough, you become laser focused. And so confusion surrounding the vaccine started as soon as it was available. And part of this was lack of data. Pregnant people were left out of the initial trials of the vaccine. And so where there is a void in information, it makes room for confusion, misunderstanding, and fear. After this episode, you will have so much more knowledge on this topic. So let's get started. Let's understand a little bit more about the history and kind of where we are. It's been tough, really tough guiding my fertility patients through this pandemic because fertility and COVID have been incredibly controversial. Guiding my patients through really tough choices, like in the beginning, patients were asking me, what does this virus do to pregnant people? What does it do to babies? Should I put my fertility plans on hold? Should I wait to try to get pregnant until after the pandemic? In the beginning, we just didn't know. So it's been 2 years. we're now in the spring of 2022. The pandemic really started in kind of the winter, spring of 2020. And I practice in Seattle. We had the first case of confirmed COVID in the United States. So a little bit of timeline and a reminder. So on January 9th, 2020, the World Health Organization announced that there was a mysterious coronavirus-related pneumonia found in Wuhan, China. I remember seeing a couple of news reports and being like, okay, it's probably going to be like bird flu or SARS or something like that. I'm sure it's not going to, impact us. But then towards the end of January, I remember January 20th, CDC says it's going to start screening people at airports that have a lot of flights from Wuhan, China. And the very next day, January 21st, 2020, CDC confirms the first U.S. coronavirus case. It was a Washington state resident who traveled back from Wuhan on January 15th, got sick, and tested positive with the PCR test. A couple of months later, March 11th, World Health Organization declared a pandemic. Bam, my kids are home from school. We're trying to figure out work. My husband is now working in the basement. This was an incredibly crazy time, and it's probably triggering bringing this back up. I mean, just trying to navigate. I remember when the kids came home from school, the school was like, yeah, we're just going to be 2 weeks. We're like, oh, it's kind of like a little vacation. It's sort of like a little break. This is going to be great. We're going to figure out how to do some schoolwork. And it's just like 2 weeks ended up being like a joke. Like Seattle was out of school for a really, really long time. Hospitals were shutting down for elective procedures. And we were trying to decide, what do you do as an IVF clinic? Like, how do you keep your patients safe? How do you keep your staff safe? Fertility treatment is not elective. It is a disease and it needs to be treated. But many hospitals were diverting resources to patients that could be sick with COVID. And so they were not allowing the ORs to be used for egg retrievals, and they were not allowing clinics to do fertility treatment. This was so tough because the fertility community, my patients already feel so marginalized. This is a disease. Nobody chooses to be infertile. It's not even covered for care in most states and most insurance policies. I mean, what disease can you think of that is not treated, right? I mean, we have coverage for Viagra, but we don't have coverage for treatment for fertility when people need treatment to build a family. These times were absolutely tough. By September 28th, 2020, global deaths were over 1 million. And schools, at least in Seattle and around most of the country, did not open up after that summer. By October 19th, global cases were over 40 million. And you remember that first Thanksgiving where the CDC recommended no gatherings? Man, those were tough holidays. But December 2020, the vaccine was available. And I remember feeling such relief. I was so excited. As a doctor and a healthcare worker, I had access to the vaccine. And I remember just the feeling of getting the vaccine, surrounded by colleagues. We felt this tremendous sense of relief, this sense of hope and, excitement that this was a step forward to ending this pandemic. But almost as soon as the vaccine was available, questions about its impact on fertility and pregnancy surfaced. And rumors and questions started about a potential of the vaccine maybe impacting fertility. And that just shot through the fertility community like wildfire. So where are we today? We're recording this in kind of 2022. It's spring 2022, mid-April. There's been over 80 million cases of COVID in the United States, close to 1 million deaths in the United States alone. About 82% of people 5 years and older who are eligible for the vaccine have had at least one shot. And 70% of people who are age 5 and older, eligible for the vaccine are fully vaccinated. But only 40% of pregnant people between the ages of 18 and 49 are fully vaccinated. We have had almost 200,000 cases of COVID in pregnancy, over 30,000 hospitalizations of really sick women in pregnancy. And between January 2020 and April 15th of 2022, we've had close to 300 deaths of pregnant women due to complications and severe infection of COVID. For Black pregnant people, the number of vaccinated patients is even lower in the Black community. Only 25% of pregnant women who are Black are vaccinated. Why are people not getting vaccinated? We know that pregnancy makes you more vulnerable to a lot of different illnesses, including COVID. If you are pregnant, you have a higher risk of severe COVID infection, higher risk of ICU admission, higher risk of death from COVID, but yet they are one of the lowest percentage vaccinated populations. Why? Fear. Fear is the number one cause of pregnant people not getting vaccinated. So how did we get here? How did we get to a point where we know that a treatment intervention like vaccination will decrease the risk of severe disease in pregnancy, but yet pregnant women are some of the lowest percentage of people who are vaccinated in our country? It all started with a rumor. It all started with a question. December 1st, 2020, which is around the same time that the vaccines were first starting to be available in the United States, a petition appeared on a German website to halt clinical trials of the Pfizer vaccine due to speculation that the vaccine may impact fertility. This was a question. This question, not based on fact, not based on data, but this question led to fear, misunderstanding. It spread like wildfire, and we have been fighting this misinformation ever since. This petition was started by Michael Yeadon. He is a scientific researcher and a former vice president at Pfizer, where he spent 16 years as an allergy and respiratory researcher. The origins of this claim really stems from a protein on the surface of the SARS-CoV-2 virus, the virus that causes COVID-19. This protein is called a spike protein, and it helps the virus enter cells. And it's one of the ways that the human body recognizes the virus and lets our immune system and immune cells know to attack it. And the Pfizer vaccine works by giving the body instructions on how to make this spike protein so it can generate an immune response and help fight the virus. There is a very small part of this spike protein that resembles a part of another protein that is vital for the formation of the placenta, and that protein is called syncytin 1. I know I'm going deep in the weeds here, but so many people ask about the origin of this rumor, and I want you to understand. So even though the sequence of this amino acid that is similar to syncytin 1 and the SARS-CoV-2 spike protein, even though it's similar, it's really, really short. It's only 4 or 5 amino acids, and it doesn't make biologic plausible sense that it would impact the function of the placenta. And we now know from years of data that this does not cause infertility or dysfunction of placental formation. But just this petition, just without any proof, it spread so quickly. It was hot. It was on the news. It was in social media posts. Fear spreads like wildfire. Fact is harder to convince people to pay attention to and read. The growth in social media and anti-vaccine accounts since the pandemic has been absolutely incredible to watch. On Instagram, just one social media platform, the number of followers and major anti-vax accounts has increased nearly 5-fold since 2020 to more than 4 million. On Facebook, the top anti-vax pages grew by 19% just within 1 year. And the followers on Twitter accounts are sort of anti-vax almost tripled. Fear fuels vaccine hesitancy. But what does the evidence show? Let's talk about COVID and fertility. These are really important questions for my patients. They want to know, Dr. Shahine, I had COVID. Will that impact my fertility? Dr. Shahine, I want to get the COVID vaccine, but I'm not sure if it'll affect my fertility. What should I do? Other questions I've gotten from Instagram, does the COVID vaccine impact sperm counts? Does a COVID infection impact male factor fertility? how long should I wait after I have a COVID infection or have the vaccine before I do my IVF cycle? These are such important questions. These are questions that I answer every day in my practice. And quite honestly, my answers have changed over the last 2 years. As more data is available, more evidence is available, I can give more solid answers. In the beginning, all I had were anecdotal evidence and contacts with doctors in China. So, as a part of being a reproductive endocrinologist and connecting with my colleagues around the country, we're asking each other questions. Where are you ordering your PPE? Are you doing temperatures at the door for your patients that come in? Are you asking people to quarantine if they have traveled lately? Like, we were all trying to figure this out together. And on one of those group phone calls, we had a reproductive endocrinologist, an IVF doctor from Wuhan, and we were able to just ask her, what is going on? And she talked about, like, we're not doing fertility treatment right now. We've had pregnant people who have gotten COVID and delivered, and the babies look okay. The babies are not infected. The pregnant women are doing okay, right? Like, that is all that we had in the beginning. Now I can talk to my patients about, wow, these studies with thousands of patients have come out. So throughout the pandemic, people have been talking about changes in their menstrual cycles. And a lot of news has picked up on this. And I've seen it in my own practice. I know in general, cycles can vary and it's quite normal. People can have varying cycles with travel, with stress, with different, things going on in their life. But is it real? Is it COVID? Is it perception? So the question is it truly happening? Are people truly having changes with their menstrual cycles? Or is it the Bader-Meinhof phenomenon? Do you know what that is? I just did a post on this on Instagram because when you're trying to conceive, it seems like pregnant people are everywhere. And there's a phenomenon for that. You just see pregnant people at the grocery store. You see birth announcements everywhere. It's just it's like the one thing that I'm focused on. Why does it keep showing up in my life? It's just a trigger. This is called frequency bias, frequency illusion, selective attention bias. And it's when your awareness of something increases and it leads to your feeling like it's actually happening more, even if it's not the case. So a lot of people were talking about and reading about and thinking about menstrual cycles changing, but hey, what is really happening? What does the data show? So there's a great study that looked at COVID and menstrual cycle changes kind of throughout the pandemic. They looked at over 12,000 women and did an online survey for over 13 months between March 2020 and April 2021 through the Ovia Health Fertility app. And 87% of people reported disruptions in cycle pattern. 29% had more symptoms during menstruation, like more abdominal pain and cramps. 27% reported increased bleeding, like heavier bleeding. And they also reported a higher level of stress, meaning people who had a higher level of stress were more likely to report menstrual changes. This is not related to a COVID infection or a COVID vaccine. It's just in general, the pandemic is a very stressful time, and a lot of people were seeing changes in their own menstrual cycle. And so what about menstrual cycles and a COVID infection? So there's 2 studies looking at COVID infection affecting the menstrual cycle. A small study out of Arizona published in February 2022 in the American Journal of Obstetrics and Gynecology. It was a survey of women aged 18 to 45 on their menstrual cycles during and after a COVID infection. They were all in Arizona. It was 127 patients, and 16% reported menstrual cycle changes. Interestingly, the people who had more severe disease and more severe symptoms were more likely to report menstrual cycle changes. Okay, but what about the vaccine and menstrual cycles? Now, this has been a really hot topic with my patients. I've been interviewed in the news a couple of times about the COVID vaccine. Does it affect menstrual cycle length? And it took a while for a really well-done study to be done, but finally, one is published this month in April 2022. They looked at almost 4,000 people and multiply that by at least 6 menstrual cycles of data. 2,400 of the patients were vaccinated, and about 1,500 of the patients analyzed were unvaccinated. So these are the 2 groups they're comparing. Most of the people had the Pfizer vaccine, 55% did, 35% had Moderna, and 7% had the Johnson & Johnson vaccine. Overall, the COVID-19 vaccination was associated with less than 1 day change in the cycle length for both vaccine dose cycles compared to pre and post cycles. And unvaccinated individuals saw no significant change in their cycles over this time period that they were analyzing. There was a slight change in the length of bleeding or the cycle length. It was less than a day between the vaccinated and unvaccinated patients. So anecdotally, I too have had patients who reported that they had an off cycle after their vaccination. But if you look at data of 4,000 people that's analyzed and looked over 6 months for these 4,000 people before and after the vaccine, comparing it to unvaccinated people, you really are not seeing a statistically or universal change in menstrual cycles with the vaccine. So I'm just so glad that we actually have data to talk about. And that doesn't dismiss, like sometimes people will hear like, oh, this study says that for the vast majority of people, they get the vaccine and they don't have a change in their menstrual cycle. People hear that and they feel like, oh, well, I did. So obviously that study is wrong, right? Like you kind of can take this and say like, well, but what happened to me is different. And so therefore the study is wrong. But science doesn't work that way. Like you want to look at a big group of people to kind of control for different variables, because in each individual person, there could be other things that are impacting the cycle length, and so if you have the question, does the vaccine impact menstrual cycle length? The best study that we have to date shows maybe a slight change in the length of bleeding in the cycle that follows the vaccine. But overall, for the vast majority of people, statistically, they do not see a change in their menstrual cycle. So, what are some other ways that you look at how COVID or the vaccine might impact female fertility? You look at ovarian reserve testing, right? Like, does a COVID infection decrease egg quality? Does the vaccine decrease my egg count? These are questions that come up every single day. So, to answer the question, does a COVID infection impact, female fertility or the COVID vaccine? Researchers have looked at, well, okay, how does the COVID infection impact ovarian reserve? How does the vaccine impact ovarian reserve? So there's actually 3 studies that looked at the impact of COVID infection and ovarian reserve. Anti-Müllerian hormone, or AMH, concentrations were compared in 91 women who had COVID-19 infection and a control group that did not have an infection, and it showed no differences in the AMH level. The second study looked at levels of follicle-stimulating hormone, anti-Müllerian hormone, and antral follicle count, and they enrolled a group of 65 women who tested positive for COVID infection, and they were undergoing IVF procedures, and they compared it to 195 women who were going through IVF and similar other characteristics like age and fertility history, et cetera. So the test group were the 65 people that had proven COVID, and the control group or the comparison group were 195 women who had not had COVID, and everybody was going through IVF. And they observed no difference in all of the ovarian reserve testing outcomes that they looked at. So the antral follicle count, follicle stimulating hormone, and AMH between the two groups. Third study looked at 118 women undergoing IVF AMH levels before and after COVID infection in 14 of those women, and the AMH levels were similar. So only 3 studies have really looked at COVID infection impact on ovarian reserve testing, and none of them have shown an impact of a COVID infection on the best test that we have for ovarian reserve testing, which is AMH, antral follicle count, and follicle stimulating hormone. Okay, so what about the COVID vaccine and ovarian reserve testing? Because certainly if I was a patient and I was, healthy and was like, well, if I get COVID, it's not going to impact my egg count or my egg quality, but so if the vaccine does, then I certainly don't want to get the vaccine before my IVF cycle or before I try to get pregnant because I don't want to impact my fertility or my chances of getting pregnant. So there's one study that is well done looking at AMH levels before and after the vaccine. In this study, they're trying to answer the question, does the COVID vaccine change AMH levels in women? There were 129 women who all received 2 doses of the Pfizer messenger RNA vaccine, and AMH levels were measured before they got their first dose and about 30 days after their second dose, and AMH levels did not change. It's a powerful study because you're looking at the same people before and after the vaccine and not seeing a difference. So that's really reassuring. So to recap, trying to understand, does a COVID infection or does the vaccine impact female fertility? You can look at ovarian reserve test results and menstrual cycle length. And in general, getting infected with COVID did not seem to dramatically change menstrual cycles in most women. Getting a COVID vaccine did not change menstrual cycles in most women. And ovarian reserve testing was not changed with either a COVID infection or the COVID vaccine. It's really reassuring to have this data. I hope that this information helps you. I truly enjoyed pouring my heart and soul into this episode and researching this data for you and for me and for everyone that's out there. I am your host, Dr. Lora Shahine, and this is Baby or Bust. If you like this episode, let us know. Give us a 5-star review and follow the show wherever you listen to podcasts. Baby or Bust is produced by Mark Ramsey, Jamie Solis, and Greg Moga. Executive produced by Paul Anderson, Nick Pinella, and Andrew Greenwood for Workhouse Media. Baby or Bust is a Mark Ramsey media production.